I like this stuff. I really get it. People are surprised that I understand it. Every one of these doctors said, how do you know so much about this? Maybe I have a natural ability. Maybe I should have done that instead of running for president.
It was Donald Trump during the coronavirus pandemic during his first term. And whatever else you think of Donald Trump, whether you voted for him or not, whether you like him or not, a public health policy expert, he is not. Now, why does that matter today? Well, there are record numbers of measles cases in our country right now. They affect kids. There's a hantavirus outbreak in the world being closely monitored. And there are mounting concerns over a deadly Ebola outbreak in Central Africa. And it is clear to everyone paying attention that Donald Trump has rendered the United States of America and the rest of the world less prepared and less safe by the things he has done. By shuttering foreign aid and USAID meant to keep diseases under control, by monitoring them and understanding them, and in the best case scenario, keeping them far away. And he has done that because he thinks those steps were, quote, radical and not aligned with American interests. Perhaps nothing is more aligned with American interests. The Ebola outbreak of a rare strain of Ebola, currently with no vaccine or treatment, has already killed more than 100 people in the Democratic Republic of Congo. It has also sickened hundreds more people, including an American doctor who has since been taken to Germany for care. Meanwhile, an international relief group says Donald Trump's cuts are partially to blame for the outbreak, forcing them to cut down their work in the now epicenter and leading to delayed detection of the disease itself. While a group made up of now former USAID staff says it, quote, would have been there with gloves and gowns and body bags and medicine, leading door-to-door contact tracing, making sure burials are safe, stopping the spread. But Donald Trump shut down USAID, calling it, quote, waste and abuse. Turns out it kept us all alive, end quote. For the record, the State Department denies that cuts to USAID have hampered the response to the outbreak. Joining us at the table, medical contributor Dr. Vin Gupta. He's a pulmonologist and global health policy expert. Miles is still here. Just tell me what under a Democratic or Republican president who hadn't gutted USAID, basically eliminated USAID, what would be happening, and then help us understand how what Trump and I guess Musk was involved in this in the beginning, what their cuts have done to our ability to respond.
Sure, absolutely. So I would say there's an interagency here at work, Nicole, you know this well, where it's USAID, PEPFAR program under the State Department, basically doing more than just treating disease. I mean, there was very noble causes in which these entities were formed, but they built laboratory infrastructure, Nicole, across the global south and parts of Africa, where we would have early disease detection of, say, a rare variant of Ebola. That's what they did, far more than just providing medication. They also, in 2014, for our viewers, worked closely with the U.S. military. The U.S. military, I'll say this as a reservist for the Air Force, played a vital role in the last pandemic or the last outbreak of Ebola in West Africa for command and control support, logistics, moving things around, medical supplies. That's critical. None of that is being talked about right now because none of that is happening. So there's an interagency response spearheaded by USAID and PEPFAR where all this medical equipment is being distributed. U.S. military is the backstop, actually moving things around, supporting patient care. None of that is happening, certainly not at the level it was happening 10 years ago. Mm-hmm. And here we are. And so what I would say is even more broadly, preparedness weakens quietly and fails visibly. In this case, they wanted it to weaken loudly. Mm-hmm. And now what we're seeing happening is quite visible tragedy. 600 cases, 130 deaths. It's going to get worse before it gets better.
What is the current status of the Ebola outbreak, and what is the risk to people traveling or people living and working there, and what are the risks to us here?
Well, I'd say that the risk is concentrated to sub-Saharan Africa, so specifically the three countries that we keep talking about now, Congo, South Sudan, and Uganda. Some concern about Rwanda and spillover just because there's a large border between Congo and Rwanda. So regionally, major concern. It's focused, Nicole, specifically in the eastern province of Congo where there's failed public health systems. There is crowded, high-density populations. So the concern here is also they don't have a lot in the way of diagnostic testing that our government would have supported at scale. So are we underdiagnosing cases? Probably. Hospital capacity is a meager fraction of what's needed. What you need is what the American doctor who's been evacuated to Germany, thankfully, is getting, which is advanced ICU level care. That's what is required to save lives. So we're going to see more cases, likely, tragically, a lot more deaths, but it's going to be concentrated. And I think the American public needs to keep in mind that the risk to them is still very minimal, especially with border closures, screenings at airports, which makes sense.
What part of Donald Trump's brain thinks that this chaos and these threats to global health are good for America?
I don't know. It's the same Donald Trump who says he's an expert on the Bible, he's an expert on trade, he's an expert on taxes and the law, and he's also a health expert. So, that's the direct answer. But, realistically, I don't think he actually, even after managing or mismanaging COVID, knows the magnitude of dealing with any of these health crises. And as soon as the hantavirus news broke, it's the first thing I wrote about. The next day after that story broke is I was out there saying, look, we're not ready for something like this to happen again on his watch. Many, many lives were lost because of that mismanagement. And as we were talking about during the break, there were 20 years of preparations after 9/11 for a pandemic and how the United States should respond. When COVID happened, Donald Trump threw the playbook out the window because it was too bureaucratically complicated for him and created a task force that struggled to reinvent the wheel in the midst of crisis. I worry that would happen again.
Yeah, and put himself in the middle of it, going to the briefing room to ask if we could put bleach in our lungs.